You know that your health tracker can do much more than just counting your steps. In fact, it can really guide a personalized care discussion with your cardiologist, like me. Hi, I'm Dr. Marvel. I'm a cardiologist at Johns Hopkins. I'm also the co-director of the Digital Health Lab here at Johns Hopkins. And I'm here to talk with you about the 4 things that health trackers can do to help you have a more personalized and evidence-based approach to being more proactive in your care. Health trackers are there to not just count steps. They can help you to diagnose atrial fibrillation or AFib. They can help to diagnose sleep apnea and make sure that if you have sleep disturbances, that gets evaluated. They can also check blood oxygen levels and make sure that if you have disturbed sleep, that's getting managed appropriately. And they can see if you have signs of hypertension and treat that earlier. It's so important to get a health tracker that helps to guide you with learning more about your health proactively. But it's really important to come see a clinician like myself, a cardiologist, or seek emergency care when you have health issues that need further attention. So don't just rely on the wearables, but use them so that together we can have a personalized discussion and really enhance your health, your happiness, and wellness for the long term.